At this time, information about liposuction will be explained. The purpose of liposuction is to create a natural body shape with curves and volume. In my opinion, a beautiful body should be one without superfluousness. It is especially important for the broken lines, hips, buttocks, and breasts to have volume. In order for the waist and hips to have a 0.7 to 1 proportion, performing only liposuction is not enough. The extracted fat should be injected throughout the waist and hips. Like I stated before, it is important to have a slim waist and hips with volume. However, if the waist is 24 inches, the buttocks should be 36 inches. In other words, the waist and buttocks should be made into a 0.7 to 1 ratio to satisfy a beautiful body with curves and volume. Before performing liposuction, pictures are taken. They are taken so the overall flow of the body shape is known and the patients can have an objective view of their bodies. Therefore, it is important to show a comparison analysis and plan the surgery with the pictures. It is important to correctly design the body standing up because the position of the skin changes when the patient lies down on the bed for surgery, and also because anesthesia causes the skin to swell. This picture shows what I think is an ideal hip shape. When the hip is divided into 4 equal pieces, each piece should have a similar amount of volume. However, as shown in the picture, Koreans have a lot of volume in the lower part of their buttocks, so overall it looks as if their buttocks is sagging. Looking from the side, the area that protrudes most in the buttocks should be like the pubic bone. The pubic bone is the protruding bone right above the genitals. Continuing on, the surgery process will be explained. Before the surgery, the whole staff prepares for the surgery with tension. This picture shows the various instruments used for liposuction. Also, the patient's body condition is constantly checked during the surgery for the patient's safety. Here is the machine used during liposuction. When performing liposuction, it is important not to destroy the fat cells. Therefore, our hospital does not use ultrasonic waves or lasers. Surgery results do not depend on the machine but on the doctor's concentration, effort, and sincerity. During the surgery, the designed post-operative picture should be referred to multiple times. Also, a picture of a lady with a beautiful body should be referred to as well to create an ideal body shape. When performing on the abdomen, liposuction should start at the lower abdomen. Performing liposuction on the flank is important because it is associated with the buttocks and the hip line. Here is liposuction on the upper abdomen. As the area around the body receives liposuction, emphasis is given in the back parts, which are the hips, flank, the area above the tailbone, etc. Thoroughly sculpt the flanks, lumbar area, and lumbosacral area to create an inward sweep. Therefore, the waist looks slim. As the waist looks slim, the volume in the buttocks appear more voluptuous. Also, to create an ideal body shape, at least 1,500 cc of fat should be able to be removed. Therefore, at least 300 cc of fat should be injected in each side of the buttocks to give good results. Here is the appearance of the backside after fat injection. The boundary line between the hip and buttocks was not clear. When liposuction is performed, that line is made. This line is very important in the body shape. The tailbone should be bent inward so the outline of the buttocks is well visible. When performing liposuction, another team separates the extracted fat so it can be injected into the hips and buttocks at the same time. The fat altogether is filtered and separated. After separating the fat, it is transferred to a 10 cc syringe. Continuing on, the extracted fat is injected in the buttocks and hips. The fat is placed in a small 3 cc syringe and injected. The fat should be evenly injected in different levels. When too much fat is injected in one area, a lot is absorbed and results are not as good. Also, it is important not to touch the nerves during fat injection. So after injecting fat into the buttocks and hips, the body shape is perfected. The boundary between the hips and buttocks is more evident. The buttocks volume increased, so the buttocks looks more like a buttocks. The waist becomes slimmer, so it looks more like a waist. Even after the surgery, the staff is very busy. They have to induce the patient so he or she safely wakes from the anesthesia. The patient should not feel pain and be comfortable. Picture number 1 above is the appearance before liposuction. As you look at the picture, the borderline between the buttocks and hip is not clearly defined. Picture number 2 below shows the immediate post-operative picture. You should all be able to see the differences in these two pictures. Pictures number 3 and 5 show the immediate post-operative picture of the buttocks after liposuction. The outline of the waist and buttocks transformed beautifully. The waist borderline is clearly visible and the area separating the buttocks from it protrudes outward. Picture number 4 shows the preoperative image. Even if Asian bodies are slim, the borderline of the waist and buttocks is not clear and the upper part of the buttocks lacks fat. This occurs frequently. When you see this before and after picture of the surgery, you will be excited to see the changes. Moving on, these two pictures show excellent bodies. However, there is a difference between the borderline of the waist, buttocks, and hip. Although this picture shows a beautiful body, it lacks a clear borderline. However, in this picture, the waist is slim and there is a clear border with the buttocks. I think this body is a more beautiful body. Lastly, I compared a before and after picture of the fat injection in the hip. There is a big difference in the line connecting the waist, hip, and buttocks. I will show a picture of this type of body surgery performed by Aone Plastic and Aesthetic Surgery. This woman in her late 30s received liposuction on her upper and lower abdomen, waist, and flank, and then received fat injection in her buttocks. The left picture shows a preoperative shape that is still excellent. However, in the right picture, her waist became slim and the volume in the buttocks improved. Most Asians will have difficulty trying to obtain this fantastic body without receiving this type of body surgery. This is the 45-degree angle view of the backside. By injecting fat into the buttocks and hip look clear and the hip also looks slimmer. At the same time, the improvement in the buttocks can be confirmed. This is the appearance from the backside. For this person, the hip area has especially more fat and the hip bone area has sunken in. Therefore, liposuction must be performed on the hip and the extracted fat must be placed not only in the buttocks but the hip bone as well to make it protrude. This picture shows a typical Asian buttocks and thighs that are commonly seen. The buttocks sag into a triangular shape and the area next to the pelvic bones are hips, but the volume is lacking there. Also, the flank fat comes outward, the thighs are thick, and the outer thigh area accumulates a lot of fat. The left and right pictures compare the backs of Asians and Westerners. Asians usually have triangular buttocks, whereas Westerners have rectangular ones. Because of a rectangular shape, the buttocks do not appear so saggy. On the other hand, the Asian buttocks appear to be saggy. Here is an appearance of the design before the procedure. The buttocks and hip received fat injection and the flank, the area above the tailbone, the thighs all around received liposuction. This is the 3 months post-operative image. Here's the view of the back side. Here's a 45-degree angle view of the back. You can see that the volume in the buttocks improved and the waist is slimmer. Here's the 45-degree angle view of the front. You can see how the line of the buttocks changed after liposuction and fat injection. Here's a 45-degree angle view of the other side. Particularly, her thighs are very thick. There is a lot of fat on the outer part of her thighs. Here is a 6-month post-operative image. Here is a 45-degree angle view of the back. By comparison, the thighs became thinner, the buttocks area came out, and through liposuction, the waist became slimmer. Here's the view from the side. This is the view from behind. Before, I stated that Asians have triangular-shaped hips. After the surgery, the change of the buttocks to a square shape can be confirmed. By changing into a square-shaped buttocks, the lower body appears longer and the buttocks look up. This woman is in her early 50s. Her abdomen girth is bigger than that of her buttocks. Here's a 45-degree angle view of the backside. This person received liposuction on her upper and lower abdomen, waist, flank, and back. The extracted fat was injected into the buttocks and hips. This is the appearance after wearing clothes. Here is the appearance of the other side. She is in her late 40s. Likewise, she received liposuction on her upper and lower abdomen, waist, flank, and back. The extracted fat was injected into her buttocks and breasts. Looking from the back, the waist became slimmer, and the volume of her buttocks became voluptuous. This person is in her mid-50s. Particularly, her stomach sticks out a lot and her buttocks were very flat. Looking at a 45-degree angle, due to the buttocks volume improvement, the lower body relatively looks stronger. After performing liposuction on the abdomen, fat injection was given in the buttocks. Due to this and the abdomen going in, the lower body looks thinner and the length appears normal. In conclusion, rather than performing liposuction to create a slimmer body, also utilizing curves and volumes is very important. After liposuction, injecting fat into the buttocks and hips to create enough volume will create a beautiful body.